18 months after President Biden promised to do more to protect people living in nursing homes, federal regulators released a long-awaited proposal. It features more oversight, efforts to expand the workforce, and unprecedented staffing requirements for all skilled nursing facilities. Avery Travis digs into the plan and how it could affect thousands of Texans.
I was upset.
Lori Mitchell still isn't sure how it happened.
And it shouldn't happen. To anybody.
An early morning phone call in January from a staff member at her mother's Round Rock nursing home saying
that my mother had passed away.
And telling her to reach out to the funeral home.
And I was confused because I had not given consent for anybody to pick her up.
Hours earlier, state records show the family of a woman who shared a room with Mitchell's mother received a similar call about their own loved one. But the records say facility staff made an error. That woman was alive.
How could you mix up these people? I understand mistakes, but that's a huge mistake.
Mitchell told us she believed her mother received good care in the 5 years she'd lived at the facility. But last year, she began to worry after she noticed some longtime nurses leaving, prompting her to file a complaint with an ombudsman about the shift in care. Federal data shows that facility has a staff turnover rate of 80% in the last year. It's a trend across the state, where the average turnover rate in skilled nursing is 60% in the last year, higher than the national average of 53%.
You have a shortage of direct care staff, and you have multiple providers that are all trying to recruit the same individual. More people are going to lose than win.
The Texas Healthcare Association represents skilled nursing facilities. Its president says the group opposes a new federal plan to require facilities nationwide to provide residents with at least 33 minutes of care from a registered nurse every day and at least 2 hours and 27 minutes of care from a nurse aide, which is higher than the average staffing rates provided in Texas right now. The state doesn't have any required staffing minimums, though, the kind of requirement Kevin Warren calls one size fits all.
It doesn't take into account the social worker, the activity director, housekeeping, the therapy staff, the dietary staff, volunteers, all of these other individuals that are in the building each and every day that are engaging. If the focus is merely on hitting a number, that's the wrong focus.
And the federal plan goes even further, proposing more facility inspection oversight and a closer look at how nursing homes are spending taxpayer funds to make sure enough goes to staff pay.
The first thing you look at is compensation, that if you don't pay an adequate amount, you will not attract people from less demanding jobs. Doing the kind of work that the nursing staff does in a nursing home is demanding work physically and psychologically.
Congressman Lloyd Doggett says he'd support more federal funding to make it happen. He's in favor of even stronger staffing standards.
I'm not sure what the answer is, honestly. I just feel like something needs to change, and if I have a small part in making that happen, my mother would be proud. Sorry.
We reached out to Mitchell's mother's facility for comment, but did not hear back. State records show, despite the mix-up, an inspector found the facility followed all protocols and did not violate any state codes, so the operation wasn't cited for the incident. Records show it also made several changes to prevent an error like this from happening again, including updating resident photos and posting more clear signs on residents' doors.
Mitchell says part of why she reached out to us was because she saw our previous investigation, Hidden Harm, which looked into how the state decides whether to cite or penalize homes, particularly in cases of harm. It's worth noting, another part of this federal proposal would analyze state inspections with the goal of ensuring the appropriate consequences are enforced for cited facilities. Federal regulators are currently accepting public comments on the new proposal before moving forward. That comment period goes on for another month. We've got a link showing you how to comment on the proposals inside this investigation online at the State of Texas page on this station's website.
We want to make sure that childcare actually receives the attention that it deserves.
The November election approaches. How you'll have a chance to vote on property tax exemptions to help childcare providers across Texas.